Hey everyone, this lesson is on rotavirus infection. Rotavirus is a double-stranded RNA virus in the family Reoviridae. Rotaviruses are the most common cause of diarrheal disease among infants and young children. Nearly every child in the world is infected with a rotavirus at least once by the age of 5. As I have said, this double-stranded RNA virus is the single most important cause of severe diarrhea during childhood. Rotaviruses are classified by serogroups to A, B, C, D, E, F, and G, or 7. Group A is the most common human pathogens, but occasionally, human outbreaks of Group B and C rotavirus are reported. The other serogroups infect only non-humans. When we see the epidemiology, worldwide, rotavirus is estimated to cause more than 111 million cases of diarrhea annually in children younger than 5 years of age. Of this, 18 million cases are moderately or severely dehydrated and they are found in Asian and African countries. And approximately 500,000 deaths per year occur from dehydration resulting from diarrhea of rotavirus. Disease tends to be most severe in patients 3 to 24 months of age. Infants younger than 3 months are relatively protected by transplacental antibody and possibly breastfeeding. Infections in neonates and adults in close contact with infected children are generally asymptomatic. Rotavirus spreads efficiently via fecal-oral route. The virus is shed in stool at a very high concentration just before and 4 days after the clinical illness. Very few infectious variants are needed to cause disease in a susceptible host. When we see the pathophysiology of rotavirus, the mechanism of diarrhea in rotavirus occurs due to two reasons. The first one is due to the enterotoxin produced by the virus, which causes water and electrolyte secretion. The other is due to direct infections of the virus to the intestinal apical cells, which causes decreased water and electrolyte absorption and impaired disaccharide activity. This overall causes diarrhea and metabolic acidosis. Rotavirus have incubation period of less than 48 hours, but might range from 1 to 7 days. And the symptoms start with mild to moderate fever, as well as vomiting, followed by the onset of frequent watery stools. All three symptoms means fever, diarrhea, and vomiting are present in about 50 to 60% of cases. Vomiting and the fever typically abate during the second day of illness, but diarrhea often continues for 5 to 7 days. In the case of rotavirus infection, the stool is without gross blade or white blood cell, and the dehydration may develop and progress rapidly, particularly in infants. Children between 4 to 36 months of age, malnourished children, children with short bowel syndrome and immunodeficiency are particularly likely to acquire severe rotavirus diarrhea and dehydration. Rotavirus has rarely been associated with mild encephalopathy and reversible splenic lesions. Rotavirus is diagnosed by antigen detection in stool and antibody detection in serum. And there are also other modes of diagnosis such as molecular methods, electron microscope, and culture. On laboratory findings, isotonic dehydration with acidosis is the most common finding in children with severe enteritis from any virus, including rotavirus. The stools are free of blood and leukocytes, and WBC count might be moderately elevated secondary to stress, but the marked left shift seen with invasive bacterial enteritis is absent. Treatment of gastroenteritis is always supportive. Correction of loss of water and electrolytes remains the goal of treatment, and failure of prompt correction of dehydration leads to acidosis, shock, and death. And later death if effective fluid replacement therapy is timely initiated. Regarding prognosis, most fatalities occur in infants with poor access to medical care and are attributed to dehydration. Children might be infected with rotavirus each year during the first 5 years of life, but each subsequent infection decreases in severity. Primary infection results in predominantly serotype-specific immune response, whereas reinfection, which is usually with a different serotype, induces a broad immune response with cross-reactivity, heterotypic antibody. The most important way of preventing rotavirus infection is having or taking rotavirus vaccine. And high standard hygiene can decrease, but doesn't prevent acquiring rotavirus infection. And also breastfeeding and probiotics is helpful to protect diarrheal disease from any cause of viral disease. This is all about rotavirus infection. Thanks for watching.